Good morning. My name is Scotty Miller, and today I'm going to be talking to you about some of the health concerns unique to the elderly living alone population. So, the elderly living alone population is a very socially isolated population that is growing very rapidly. For this presentation, we'll be using elderly to mean greater than 65 years old. Now, there's a few reasons why this population is growing so rapidly. First, people are living longer than ever. Over the last 50 years, the average life expectancy in America has increased from 68 years to 79 years of age. Likewise, in 1985, older adults accounted for 11% of the U.S. population, but by 2030, 1 in 5 Americans will be 65 or older. So we know that as a whole, the elderly demographic is growing very, very rapidly. Now, for the living alone component, today, 1 out of 3 of older adults living outside of nursing homes are living alone. And women in particular are at an increased risk because statistically they live longer than men. So when their spouse passes away, they're often left living by themselves. According to the Utah Senior Guide and Institute on Aging Statistics, Ogden currently has approximately 2,500 elderly individuals living alone. Utah has 65,500, and America has 11.3 million seniors living alone. So you can see that's a pretty large demographic. Here locally, we have 2% of our elderly population living alone, while 3% of the elderly population in America is living alone. So we have a 1% less statistic here locally. Interestingly, Utah has the lowest percentage of single-person households of any state in the nation. And this could be related to a strong family culture, a high quality of life, and significant access to quality health care here in Utah. So this is a very socially isolated population. So obviously social support is going to be a key social determinant of health that they're at risk for. They're living alone and they're isolated, and they're also elderly, which has its own challenges. But being alone means that they have considerable issues with access. So do these individuals have a way to get to the doctor when they need to? Do they have a reliable way to get to the grocery store or the pharmacy? What are their options in terms of transportation? Do they have neighbors or family or friends willing to help them when they need it? Do they have a reliable source of transportation? Are they able to safely drive themselves to where they need to go? Also, as a social determinant, access to mass media and emerging technologies is interesting with this group because there are people who grew up in a completely different time in a different world. So, do they understand the new technologies that are available? Do they know how to fully utilize the resources that are put in place for the socially isolated in particular? Because if this population is not able to understand the resources available, then they're essentially useless in regards to benefiting them. Now, we're going to talk about some specific concerns. We're talking about elderly individuals here, so there's many pre-existing physical, psychosocial, and economic concerns before we even begin to start talking about the living alone dynamic. So what does that mean when we're looking at a population that already is vulnerable and at risk, and then we put social isolation on top of it? Physically, these people are suffering from several chronic conditions requiring different doctors and specialists without the use of someone in their home to help them manage all these symptoms and medications and appointments that are necessary. That means sometimes some symptoms get missed completely because they don't have someone who's watching them every day and seeing these changes. Also, they're at an increased risk for medication errors because they have polypharmacy, several medications that they're responsible for tracking, and they don't have that additional help of someone with them to help manage these medications. Psychosocial, these individuals are at huge risk for depression and anxiety secondary to their social isolation. They're suffering from chronic pain, debilitation. They can sometimes see themselves as a burden on their family or society. They're losing their friends and their loved ones to death and illness, and they have a real lack of emotional support. And all of these can put them at an increased risk for both depression and anxiety. Finally, economically, according to Pew Research Center, older adults living alone are twice as likely as those who live with others to say that they don't have enough to meet their basic expenses. Also, this population was found to be 3 times as likely as those who live with others to be poor. These individuals are on a fixed income. It's a single home income, so that's a significant factor here. They're also living longer than they were previously, which means that their retirement funds are no longer adequate to see them through to the rest of their lives. So these are all risks that increase the likelihood of poverty among this demographic. So what is the root cause of all of their health vulnerabilities? And the root cause would have to come down to social isolation. It's the contributing to their risk of accident or injury without adequate access to care in an emergency, or even access to meet their basic needs, such as transportation to the grocery store or pharmacy to pick up their medications. Social isolation is contributing to their risk of anxiety and depression. It's increasing their length of hospitalizations because they don't have that support built in among the community. Now, when we look at Maslow's hierarchy of needs, these individuals could have issues at all levels of the pyramid. However, when we're looking at the whole of the population, they should be meeting their physiological needs. They have to come up with a way to find food and water and these basic instinctual needs, or else they would not be surviving at all. Of course, meeting these basic needs is considerably harder for this population than others. However, they have to be meeting it in order to survive. Another area that this group may be meeting is the top tier of self-actualization, and this acceptance of facts and being able to fully accept their place in society and role within their community may actually be linked to higher rates of depression and anxiety, so it may be doing a disservice to them. If we're able to look at this demographics unmet tiers, we'd have to talk about safety as the number one unmet need for this population. They don't have security of health, of home, of resource, or finances. They are not meeting their love and belonging, and that's directly tied to their social isolation. Esteem can be difficult as well when socially isolated. As a whole, we'd have to anticipate that this population's anticipated functional level is going to be fair. And that would be, the high end. I think overall they probably are poor to fair. They have considerable unique risks on top of their inherent risks of just being in the elderly demographic. Likely health outcomes, we're going to be seeing an increase in malnutrition, in depression and anxiety, in heart conditions, heart disease and hypertension. We're going to have an increased risk of trauma and falls, as well as several other negative outcomes. Now, when we look at communicable diseases or infections, the fact that this population is socially isolated can actually be viewed as a benefit in this specific category. Since they're not at a high likelihood of exposure, they're at a decreased risk of transmitting a communicable disease. However, social isolation and their advanced age both contribute to a decreased immune system, which increases their risk of contracting a communicable disease. Also, their lack of access to transportation means that they have a harder time gaining access to vaccinations like the yearly flu shot or a pneumonia vaccine. So while they are socially isolated, when they find themselves among the general population, they're going to have an increased likelihood of infection. And this is where home health can come in, and those vaccinations offered at your pharmacy can be helpful and help mitigate that risk. Some specific non-communicable diseases has shown that social isolation increases risk of hypertension, heart disease, obesity, anxiety, and depression. They're at an increased risk, and they also don't have a partner or loved one who's watching them or identifying new concerning symptoms that require medical evaluation or management. Specific concerns related to self-care. The elderly population already has an increased risk of falls related to impaired vision and hearing, medications, and cognitive impairments. So we need to be really careful to make the home environment as risk-free as possible. And that means installation of handrails and supportive devices, removing throw rugs, and installing night lights. And this can all help to decrease the risk of accidents. When they do fall, there isn't someone there for immediate assistance because they're living alone. This is where the medical alert devices can be helpful, and these are wearable devices that the individual can push a button if they ever need help, and it contacts local emergency agencies. When they do reach the hospital after a fall or an illness, they have an increased length of stay because they don't have that support after that hospitalization. This can lead to secondary infections because of their weakened immune system, and then more comorbidities at that point. This population has a higher incidence of unintentional overdoses because they are on multiple medications, and then they do have cognitive impairments. So when they do possibly have an accidental overdose, they don't have someone who's recognizing these symptoms and can seek emergency care. And so that can be really difficult for them. Ways to mitigate this risk would be pill organizers with reminders built in to help them comply with their medication regimen. They should also be encouraged to dispose of any old or expired medications in their home. Malnutrition can be a risk for any elderly population, but for those living alone, it can be exacerbated because the individual doesn't have the desire to cook proper meals and is eating alone, so doesn't have the motivation to do that. There are outreach programs such as Meals on Wheels that can help and assist this population with their needs that way. Social isolation can also accelerate and increase cognitive decline, where, again, there are several existing social programs that have been developed to help mitigate this risk as well. The elderly living alone can be at an increased risk for crime. The National Crime Prevention Council created a brochure entitled Safer Seniors, which medical professionals should provide when they have interactions with this population. They recommend installing good locks on doors and windows, making sure that their address is large and well lit so emergency personnel can locate it easily, and to ask those who come to the door unexpectedly for photo identification if it's like a serviceman or a delivery person. They're also at risk for financial exploitation, and so it's really important to educate these people. They're at an increased risk because they don't have people around who are noticing suspicious circumstances and can intervene or say, that's not a good idea. So it's really important to educate the elderly that they need to be careful when establishing phone or email communications with strangers, or some popular scams that target this population as well. If they're educated about these, then it can help with that risk. They can be a potential risk to others when driving. Since they're isolated, there's not someone who might be noticing their cognitive decline to the point that they shouldn't be operating a motor vehicle anymore. And so this can put them at an increased risk of accident or injury. So if we as healthcare providers are seeing these elderly people in the hospital following a motor vehicle accident, it is a good idea to contact social work and begin an evaluation in their safety in terms of maintaining a driver's license. So in summary, the elderly living alone population is a socially isolated, vulnerable population that is rapidly growing and expanding, and we as healthcare providers need to be prepared to promote education and safety modifications to help combat their many unique health risks. This is just a list of my references used in this presentation, and thank you so much for taking the time to listen and follow along.